Let's talk about glomerulonephritis. What exactly is glomerulonephritis? It is simply the inflammation of the glomeruli. Now this occurs bilaterally, meaning on both your right side and your left side. Your right and left kidney are both affected. Now if glomerulonephritis, or if this inflammation is not resolved, if it is not treated, it may end in renal failure. Now because the kidney is being infected or affected, the glomeruli are becoming inflamed, this is an intrarenal complication. So this would result in intrarenal failure or acute kidney injury. Now, what are some causes? Number one, systemic lupus erythematosus, or SLE, systemic sclerosis, or 3, the most common, a strep infection. Now, this will typically be more common in children and young adults, the strep infection. Now, I'm not going to get into the specifics of the immune complex, but remember, you're getting infected by strep, a bacteria. Your body's going to react by producing antibodies. Well, in glomerulonephritis, the antigen being the bacteria, the bad guy, and your antibody kind of clump up together. This clumping ends up in your kidneys. Remember, your kidneys are filtering your blood. So these little clumps end up in your kidney or in your glomeruli, and these cause damage. These cause inflammation. So keep that in mind, because we're going to focus on our clinical manifestations now. And remember, for your Nclex exam, make sure you know your clinical manifestations and your interventions, because that is really what you're being tested on. So let's get right into those. Now, I just mentioned how the antigen and the antibody are going to combine, making a complex, a clump. This clump is going to go to your kidney, and since it's a relatively large molecule, it's going to cause damage. Think of it like somebody putting sugar in your gas tank. That's going to kill your engine. It's going to cause lots of damage because those sugar particles, they're not going to be able to do anything for you. They're just going to cause damage. Well, same thing here. This immune complex, it causes damage to your glomeruli. That damage will result in hematuria, or blood in your urine. So if you were to do a UA, you'd find that in your urine you have red blood cells, white blood cells, and very, very important for you to know for your Nclex exam, casts. So again, if on your Nclex exam you see casts anywhere, it most likely indicates that there is some type of renal pathology, whether it is acute kidney injury, chronic kidney disease, or in this case, glomerulonephritis. Also, you'll most likely see proteinuria, or protein in your urine. Again, there should be no red blood cells, there should be no protein, there should be no cast in your urine, but because your kidney is damaged, because your glomerulus is damaged, it's allowing these large molecules to get dumped into the urine. That again indicates that there's some type of renal pathology. Number 2, increase in your BUN and creatinine, and a decrease in your GFR. So we're causing kidney damage. Now, if you go back to the lectures on acute kidney injury or chronic kidney disease, we discussed that your kidneys, the purpose of your kidneys are to rid the body of waste products. Your kidneys are also going to be getting rid of excess fluid. They're going to be producing urine. So if your kidneys are not working, remember, bilaterally, both right and left side are being affected. Again, if they're not working like they should, you're going to have an increase in your blood urea nitrogen levels. Creatinine is going to rise. That's going to show us, or that's going to tell us that your kidneys aren't working like they should. Your GFR is going to go down. It's going to decrease. Remember that GFR stands for glomerular filtration rate. So if your kidneys, or in this case your glomeruli, are damaged, if they are injured, they are not going to be able to filter like they should. Therefore, you will have a decreased GFR. Number 3, Your urine, if you see this on the Nclex exam, make sure you know this, okay? Your urine will appear dark brown, rusty colored. It may also appear frothy or foamy. So if the patient comes in, they've had throat infection, difficulty swallowing, complaining of flank pain, you do a UA and it looks very, very dark brown, or if it is frothy and foamy, that could be an indication of glomerulonephritis. Make sure you know this for the Nclex exam, because I've seen this on a lot of questions. I've seen a lot of test questions. Number 4, decreased urine output. Again, our kidneys are being affected. We just talked about how your glomerular filtration rate is going to go down. Your GFR is going to go down. Also remember that in acute kidney injury or chronic kidney disease, we talked about if the kidneys are injured, they're going to stop producing urine because they're no longer working. So in this case, again, check out urine output. Most likely you will find that again there is decreased or maybe no urine output. Now, because there is no urine output, you're going to be retaining all that fluid. So patients will suffer from edema or fluid retention. Now, again, I talked about how typically if it is caused by a strep infection, children and young adults will be affected. So one of the huge clinical manifestations that you'll see, one of the signs and symptoms, is periorbital edema, swelling around the eyes. I got this mixed up. Periorbital edema is not going to cause shortness of breath, but something like pleural edema, fluid accumulation in the lungs, that will cause shortness of breath. So let's fix that here. Pleural edema. Again, we have that because we have fluid accumulation. You are unable to void. You're unable to get rid of that fluid. If it continues, patient will also suffer from peripheral edema, swelling in the lower extremities, swelling in the hands. Again, all this will result in difficulty breathing. Also, because you have increased amounts of fluid in the body, patients will suffer from hypertension, elevated blood pressure. Number 7, flank pain. Remember, your kidneys reside in your back region or in your flank area. So if they are getting damaged, patients will complain of flank pain bilaterally. 8, you must know this if, again, the glomerulonephritis is not treated, if the strep infection is not treated properly with antibiotics, then the end result can be end-stage renal failure. So again, you always want to ask your patients, have you had any fever? If you're coming in through the clinic, through the ER, it's a little kid, swelling around the eyes, sore throat, with the fever and flank pain, again, it's going to be indicative of glomerulonephritis. So again, we must treat the cause, we must treat the strep infection. If not, the end result could be end-stage renal failure. So what are some diagnostics? What are some diagnostic studies that we need to know or focus on? Number 1, throat culture. We want to check for strep. Number 2, serum BUN and creatinine. Serum BUN levels will be higher than 100 to 200. Remember that the normal is 10 to 20. Creatinine will be elevated, higher than or equal to 6. Remember that normal creatinine is 0.6 to 1.2. Make sure you know your lab values for the Nclex exam, guys. Decreased GFR. Just like I said earlier, if your glomeruli are not functioning, working like they should, they cannot filter properly, so your GFR levels will go down, or you'll have a decreased GFR level. Number 3, if you were to do a UA, you'd find RBCs, red blood cells in urine, casts. The urine-specific gravity would go up. It would be increased. This makes sense. You have less urine production, therefore it will be more concentrated, making that urine color very, very dark. Number 4, changes in your electrolytes. Again, we talked about this with acute kidney injury and chronic kidney disease. You'll have changes in your sodium, potassium, magnesium, calcium, everything will be changed because, again, your kidneys aren't functioning like they should. Number 5, positive ASO, anti-streptolysin titer. That indicates positive strep test, or indicates that the patient is positive for a strep infection. Also, you may find something like 6, an elevated ESR level. That simply indicates that there's inflammation in the body. Now, we've talked about ESR in a different lecture. We talked about this when we were talking about arthritis. So if you don't remember that, make sure you know that. Go back and look at that lecture because most likely you'll see that on the Nclex exam also. Interventions. What are we going to do for these patients? Number 1, rest. We want to put less of a demand on the body. We want to let that body heal. Number 2, if strep is the cause for this glomerulonephritis, again, you want to rid the body of the infection. So you're going to start antibiotic therapy right away. You're also going to tell that patient, family members, mother, dad, to complete or to finish the antibiotic therapy. We talked about our heart problems and how this strep infection can also affect the heart. So if it has spread to the kidneys, it also has the potential to affect the heart. So again, we want to make sure that the patient is completing all of the antibiotic therapy. Number 3, fluid restrictions. Again, we talked about how there's going to be decreased urine output. So most likely the patient is going to be retaining all that fluid. It can go into the eyes, periorbital edema, it can go into the lungs, pleural edema or pleural effusion, go into the extremities, peripheral edema. It can, again, cause hypertension. So we want to restrict the fluid. We want to prevent hypertension. Also, you want to do a daily weight. And you want to report any excess weight gain. So if the patient has gained 2 pounds or more in 24 hours, you need to report that to the physician immediately. Also, you're going to restrict sodium intake because, again, you don't want to bring blood pressure levels up too high because you can cause some other complications. Number 5, protein restrictions. This will be if the BUN is severely elevated. 6, you may administer diuretics, something like Lasix. Again, you're going to administer diuretics so you can hopefully get rid of some of that excess fluid and bring blood pressure back down. So number 7, you may give some antihypertensive medication. Again, if the blood pressure is getting too high, you're going to put more demand on the heart. So you want to bring that blood pressure back down. And number 8, finally, patient may undergo something like a plasmapheresis. And this will be done in hopes of removing the antibody antigen complexes out of the circulating blood. And this will be done in hopes of getting the glomeruli or the kidneys to regain function.